Zizipho Zips Bopoma. Winoko on Tru FM. Like no one else.
26 minutes before 7, Winoko proudly brought to you by SABC Education in partnership with Tru FM. Sibahle kakhulu Amanda Khala. She's back again ngomvulo between 6 and 6:30 with True News khona ngomgqibelo kusasa ku interchange between 6 and 6:30 igama nguZizipho Zips Mbophoba. Namhlanje Winoko we are looking at breast cancer awareness. October is breast cancer awareness month, and today the 13th of October is metastatic breast cancer awareness day. This time to gain and spread knowledge of what sufferers are up against and how society can help. Metastatic means that what began as a case of early stage breast cancer has metastatized or spread to other organs. Sources are nzulu breast cancer and understanding the stages, early detection and self-inspection. On the line we have our oncologist Dr Sibahle Ndamase. I will be getting into this with us. Kodwa ke nawo bangabona umbuzo namhlanje ngomcimbi esijongene nawo we breast cancer awareness. Ungasifonela ku 086 000 2375 okanye usithumelele umbuzo wakho kwinamba yethu ka WhatsApp on 0605842833. Sikhona ku Facebook singu Tru FM. The hashtag is #Incoko. Nchilo ke ndathi joining us on the line today we have oncologist yethu Dr Sibahle Ndamase ozawuncokola nathi asicacisele so that we understand into bana xa kuthethwa nge-breast cancer kuthethwa ngantoni na. Doc, sikwamkele enkqubeni. Thank you so much for joining us.
Oh, molweni maphulaphula, and thank you so much, Vips, for inviting me. I'm so excited.
Kakhulu Doc, thank you so much ngohlala nathi namhlanje. Sijonga umcimbi obaleke kakhulu Doc, encinga into abantu abaninzi kuyafuneka sifundisiwe kakhulu ngawo, ingabi yonto eyenzeka only xa kusithiwa yi-breast cancer awareness month okanye yi-cancer awareness month, beyinto esihleli nje siyakhunjuzwa ngayo kwaye siyafundiswa ngayo. Ndifuna siqale apha Doc, besikhe sancokola about the 5 big cancers before apha enkqubeni, saphatha ke nakwi-breast cancer lena sawuncokola ngayo namhlanje. Kodwa kubonakala ukuba ke kukho abantu abangayiqondiyo ncam into bana yintoni cancer. Mhlawumbe ungathini xa udefine cancer, kwenzeka ntoni emzimbeni womntu xa kusithiwa umntu une-cancer?
Okay. All right, so into eyenzekayo xa kuthiwa une-cancer, it means that most of the time sisigaxa okanye it's a mass, something that is there, ekhulayo, that's not supposed to be there. So ixesha elininzi we know why the cause of cancer is there, because as umntu ekhula, especially abantu abadala, as umntu ekhula the body reproduces new cells all the time. All the time the body is repairing itself. So it's doing that repair process the whole time. But sometimes when you have a problem in your genetics, or you have something in your blood or in your genes, and the repair processes as normally in the body, then the body makes a mistake. That's what's called a genetic problem, or something in the genes of the body. It makes a mistake, and then it cool over and above what it's supposed to be. And then like it normally would, and then it cool cancer inside the body.
Okay.
And this can be anywhere in the breast, any of the organs, in the skin, in the blood, anywhere. And that's what is cancer, is when there is a mistake that's not fixed properly, and it could be any reason, many reasons as in the guy with cancer, so we can get into them for each breast cancer specifically, but it's a mistake that was not fixed, and go umzimba awukwazi uyilwa, and then that cancer leso sigaxa sikhule, and then ke ngoku it overtake umzimba, and then ke ngoku kubekho i-problem. And that's where I come in as an oncologist, specifically ofundele i-cancer or i-treatayo i-cancer when it's diagnosed.
Doc, ndiyafuna ke ngoku singene kwi-breast cancer. I-breast cancer yona yintoni, kwenzeka ntoni ebeleni xa kusithiwa umntu une-breast cancer, and please take us through i-stages zayo, yoba mhlawumbi iqala njani, noba mhlawumbi funeke sibe kanti uze ube okanye ungabekho kwi-risk enkulu, funeka ube kanti uzayibona xa ikwi-stage esitheni, zonke ezi stages zayo zithetha ukuthini. Xa kusithiwa iku-stage 1, iku-stage 2, ithetha ukuthini yonke laa nto?
Okay, ke my love. So into eyenzekayo, usually abantu abaninzi bazova something in their breast.
Okay.
Yabo. Bave into igaqa eliqinileyo in the breast, mhlawumbi. Yabo, xa uhlamba uva apha phansi kwekhwapha okanye apha phansi kwebele okanye xa uzithi uyaziva, especially that's why self-examination is very important. Ngoba nje xa uhlamba unyusa mhlamba phema khwapheni uve ikhona into ivayo apha engaqhelekanga okanye uthi xa uphatha ibele uve indawo engekho buhlungu, which is why abantu abaninzi don't take a problem like kuba ikhona ingxaki because ayikho buhlungu. This esigaxa is painless, and that's why you feel something like ayikho buhlungu, but into eqinileyo wethu lapha ebeleni okanye phantsi kwekhapha nje buhlambe, and then umane uyiva le nto and then uyiva ukuthi ngathi iyakhula nje. So that's the first sign is for you. Xa uhlamba uba funeka uzitshekishe. You have to examine yourself. Uwazi amabele akho ba anjani, so that if ikhona into oyivayo that is abnormal, then you can feel it. Abanye abantu with breast cancer can have i-discharge apha kwi-nipple. Uthi xa ucofa apha kwi-nipple mhlawumbe phuma igazi okanye nje into i-discharge engekho right kwi-nipple. Okanye sometimes even on the skin kubonakala some discoloration okanye kubonakala something wrong with the like nipple ibe ngathi iyatshona ijonga the other way around, iyatshintsha ikhala, iyaqalisa urhawuzelela ibe itchy. Those are some of the signs of breast cancer, and this is the same for amadoda as well. It doesn't just affect abantu abangabafazi, but usually ngabafazi who are affected. But I've had patients abangamadoda. We know it does happen in men as well.
Okay.
So that's the first thing it presents. And for you to know uba mhlambe kwi-risk for breast cancer, you have to understand that if mhlambe kwifamily yakho umama wakho okanye uaunt wakho okanye your grandmother or anyone in your family one breast cancer, the chances of you having it are higher than umntu ongenayo a history in the family of breast cancer, because we know that breast cancer can be inherited from other family members. You know that goes through the genes to you. So once uyazi ba uaunt wakho une breast cancer okanye umama wakho une breast cancer, nawe funeka uthi make sure that you go check. So sikwazi kanjani uchekisha for breast cancer? Let's say up in South Africa we're able to do screening for breast cancer. Okay. Any woman above the age of 40 years old is supposed to have a mammogram.
Okay.
Londo ithetha 40 and above uyakwazi ukuya clinic okanye esibhedlele esikufutshane nawe, and then they can book you for a mammogram. At least ube nayo, especially ke ngoku xa une cancer, family history cancer, and then at least uyakwazi basikwenze lo mammogram. If you need medical aid, you must, at least on 40 years and above, go for a mammogram. But kulapha mammogram X-ray enziwayo apha ibele liyacinezelwa lichekishe uba alinayo na cancer. It's one of the easiest ways so that we can do checks to prevent cancer, so that at least ibonwe kuse early. Now you asked me about his stages. Let's say ke ngoku for some reason uyivile ke ngoku esisigaxa, what do you do? Then into eyenzekayo uyahamba eclinic okanye kugqirha wakho i-GP yakho umbonise gqirha ndiniva esisigaxa. Ixesha elinintsi abantu bathi mhlawumbi i-infection. No, you must say gqirha ndive ngento ye-breast cancer esebantwini ngoku. So in this breast cancer month, you must not just say it's infection or take antibiotics. You must ask for a mammogram, or you must ask jonge, because breast cancer iyabonakala ebantwini, even young people. I've had young 35-year-olds, 30-year-olds with breast cancer. It's no longer a disease for abantu abadala only. So you know that we need to make sure that not as youngsters we are aware uba iyenzeka, and we cannot leave it uba ikhule ibe nkulu, because that affects the outcomes noba uzophila ixesha elingakanani once we have found by cancer nyana. So you go to your doctor, does a mammogram, then you go to a surgeon ngumntu ohlinzayo ozothatha icwezana yalo sosigaqa ayise enze bizobona specifically under the microscope by cancer nyani na. Asikwazi ukwenza a diagnosis of breast cancer without taking a sample of whatever is there, and sijonga specifically for you uba cancer njani. Then after that we can do staging ke ngoku. Staging means funeka sithi make sure ayihambanga yaya kwenye indawo ilapha ebeleni okanye yaya kwenye indawo, like you said about metastatic breast cancer awareness day. That's part of staging. So staging senze x-ray, senze ultrasound, sijonge izindawo ezithanda uba cancer iye kuyo. Breast cancer iyathanda ke emaphapheni, iyathanda to go to the liver, sibindini, iyathanda emathanjeni. So we need to make sure ezo zinto zontathu are not affected.
Yeah.
And that's part of staging. So it's very important. Once ave isigaxa it's painless most of the time, that they go and get it checked. So if stage 1 unyanisile, it's just in the breast, no problem.
Okay.
Stage 2, say inkulu size ebeleni, and then mhlambe ibe nento encinci upper under the armpit. Stage 3, it means seyingenile into the armpit, ingene kwinto ekuthiwa zii-lymph nodes, singamadlala, underneath the armpit. Then, and if it goes to stage 4, it means ke ngoku seyiphumile ebeleni, yaya either emaphapheni, emathanjeni, or esibindini. And that makes it difficult. The more ulinda, the more ikula, because ikula kanjalo breast cancer, the more ulinda uyeke, izohamba iye kwezo ndawo, and then it becomes difficult to treat. But it doesn't mean that naxa stage 4 okanye stage 1, we won't be able to treat you. That's when you come and see me as an oncologist.
Yeah. Doc, you spoke about the minute ubana 40 and above, funeka uye, especially if kukhona history yabantu abane breast cancer kwifamily yakho. But ke ukuba ngaba una 40, uyakwazi ukuya uthi ndicela nindichekishe mhlawumbe noba udanga wabona lump ebeleni lakho kanye phansi kwekhwapha, uve uqonda andifuna uchekishwa, so that ndizaba sure uba akukho nto irongo ngam.
Okay, the only time to check isha below the age of 40 is if when a family member who had breast cancer in their 40s.
Okay.
So, for instance, if mama wakho wine breast cancer mhlambe at 40, then when you're allowed from the age of 30 uba ucheck isha, so that sikwazi ukucheck isha, then you can say, please, ndinale cancer history in my family from umntu owayemncinci themselves.
Okay.
Umama okanye aunt wami okanye umakhulu wafumana i-cancer in their 40s where breast cancer, I'm allowed ke ngoku uba ndiye earlier because of that.
Okay.
But for normal everyone, 40 is the time we start checking.
Okay. You also mentioned umcimbi woba nabantu abangootata bayakwazi uyifumana i-breast cancer. Yenzeka njani? Because kaloku sinalanto yoba banawo amabele nebhat abanawo lamabele ethu as females. So yenzeka njani kubo ke ngoku?
Okay, so it happens the same way it happens ebantwini abangabafazi, because even though like flat, they've got a bit of breast tissue.
Okay.
That breast tissue is where the mistakes can happen. So even though icon needs a fun in amabele etu, but still, it's still there. So even if uyindoda, then you still need to check, over something, you must check. Because it can happen. And there's other things that now have come out it causes the breast cancer besides the family history of the breast cancer. We also know that diet is playing a role. If you are overweight or obese, it plays a role in your increased chances of the breast cancer. And sometimes we know that if you're taking estrogen or anything like that, it can increase the chances of a breast cancer in you.
Sure.
So that's why it's very important they must continue babake healthily. And the diet here, the way ingakhona ngoku, we are all at risk because asatya ngalandlela asatya ngayo kudala. Ayiseyo disease yabelungu qha lena, it also affects us as abantu abamnyama because indlela esitya ngayo abanye abantu bethu overweight, and so we are now exposed to the same diseases as
yeah. Is it preventable ke ngoku doc kuba sikhe sive kuthiwe sanuzitya noodles, uba nitya noodles kakhulu nizaba ne-breast cancer, sanufudumeza ukutya kwi-microwave, if ufudumeza ukutya kwi-microwave, like zininzi izinto ezithethwa ezisenza soyika uqonde andiyazi ke uba unoba funeke ndenze njani. Is it preventable? Ingaba mhlawumbi zikhona ke nyhani izinto kufuneke siziyekile ukuzitya nje tu kuba ukuzitya kwethu kakhulu mhlawumbi zizawuincrease chances zethu zoba sibe ne-cancer?
I mean, there's always something you can do to prevent cancer. The one most important thing to do you can do to prevent cancer is to stop smoking. Don't start smoking. That is the number one thing you can do. Other important things you can do, you must, diet is very important. We know that most of the big 5 cancers are caused also by diet. Diet is very, very bad. How do you then eat? You have to eat processed. Yabona zonke izipoloni nezinto esingazazi nazenziwa phi and zenziwa kanjani, anything coming from a cardboard box, that's processed. Remember fruit, vegetables, things that come out from the ground, inyama, it's a piece of chicken, not processed. Processed food is the one thing you can cut out of your diet and eat whole foods, like ukutya okubonayo ba ukutya iyayibona ba nyama enkukhu lena liphiko iyayibona ba i-vegetable lena It's not coming from a packet. So your Londo is very important. Diet yakho, it must be most of the time ukutya okuphekiweyo okwazi okubona uba kukutya. Nothing, not izinto ezininzi ezisuka from diet yakho that come from a packet. And then to maintain a weight yakho, you must exercise at least 3 times a week for 30 minutes. You must move your body. Especially means we sit in offices, in chairs. We don't move around, so you need to exercise. You need to keep your body strong. And also, you need to then at least when the mammograms, when the pap smears. When you get to the age of 50, you can start doing colonoscopies. So there's that you can do to try and prevent that if there's something, if we say early, because stage 1 is very different from stage 4.
Yeah, ndiyafuna sincokole ke ngoku doc kanye speaking of into bana utreat stage 1 different from utreat stage 3 or 4. Ndifuna singene kwi early detection. Umcimbi early detection ubaleke kangakanani into bana ibhaqwe kwangoku kuse early mhlawumbe ikuncedisa phi? How is it different xa ibhaqwe ise ku stage 1?
Early detection is the key. It's the key because that means that we can cure that cancer. Iphele nya emzimbeni wakho if you catch it early. And then it only needs one mode of treatment. Usually, operation by a surgeon will be able to take care of that. Then we can do a follow-up. You don't even need to come into oncologist because it's early stage. It's early. And then we can watch you. And then we can make sure that at least you are cured from that cancer. The minute we get to stage 2, 3, and 4, it means that you need 2 or 3 modalities of treatment. So that means you need operation from a surgeon, you need chemotherapy from me, you will need radiotherapy from me, you might need endocrine therapy, so you can imagine that now we're moving to you seeing more doctors, more visits to hospitals, and it will have side effects because yonke treatment has got side effects. Without side effects. So the earlier we get it, the less treatment we need to give you, and the less side effects that we will expose you to.
Sure. Okay. Ndifuna ukukhumbuza ke wena mphulaphula bangabusana ngene enqobeni namhlanje we are talking breast cancer awareness sincokola ke oncologist yethu namhlanje uDr Sibahle Ndamase bangabona umbuzo 086 0002375 xa sibuye.
You voted and we counted. Your votes have brought us to the top. Zizipho Zips Bopoma. Winoko on Tru FM.